Well, thank you very much. Any question and comments from the floor? Luca.
Thank you. Because of your experience in cancer patients, you said already something, but I'm curious. Do you see yourself differences in coping with the cancer and sexuality in elderly couples as compared to younger couples? Or have you ideas about that?
Yes, I think there is a considerable difference. I mean, if you have the younger patients with breast cancer, and if you compare it with the older patient with breast cancer regarding the suffering from sexual dysfunction, I think there is a considerable difference. And the younger women suffer much more and are much more handicapped by the long-term treatment. I think the same is true, of course, also for genital cancer. If you have a young woman with a cervix cancer who needs radiotherapy, as you know, or has had radiotherapy, the impact on her sexual life individually, the individual suffering is more important, I think. Which doesn't mean that you shouldn't care for the older patient. But,
Any further question? I do have a sort of provocative question. For us, dealing with sexual medicine and sexuality, there is always the risk of medicalization of a problem. Do you believe that in elderly persons, this risk is even higher than in younger?
I fully agree with you. This is why I wanted to stress the point that, I mean, more than 50%, if I look at our consultations, more than 50% is just counseling. Information, taking myths away. I think quite a number of couples, you know, when you discuss with them and try to explain them how the changes have come about and what the impact is and what the solutions would be, they say, okay, that was really interesting, we had a talk, they come back and they said, you know, we decided that making changes, like taking drugs or something, is too much for us. I think we have found a new way of living our sexuality, and but they are grateful for the fact that it's normalized somehow. Because a lot of people, elderly couples, think if they don't function sexually, this is a sign of loss of love and bonding. And really try to make them comprehend that this is a different thing from love is important.
Thank you very much. Any further question? No, that's fine. We do have coffee break right now. Thank you very much.